I'm Hannah. I'm going to be doing a Foley catheter today. So first I'm going to knock on the patient's room and I'm going to provide privacy. I'm going to enter the room and perform hand hygiene. We do not have a sink in this room like we would in the real life. So I'm just going to verbalize and demonstrate that I would be washing my hands with soap and water and fully drying them, drying my hands, discarding a paper towel, taking another paper towel, shutting the water off. Now I'm ready to enter the patient's room and say hello. My name is Hannah. I'm going to be inserting a Foley catheter today. Can you tell me your name and number?
Doing an internal feeding today.
I'm just double checking that. Awesome. Do you have any allergies to latex or iodine? No? Okay, that's perfect. And now I'm verifying that I got a doctor's order to insert a Foley catheter, which I have. So I'm going to go along with that. I'm going to raise the bed to a comfortable working height.
And I'm going to identify my patient with their wristband. And I can also ask what's your name and date of birth.
And now I'm just going to position the patient into a comfortable position for myself and her.
The order says the patient needs to be fed. And first, I'm going to do an abdominal assessment. I'm going to raise that over there.
Okay.
Make sure the patient's supine.
Now I'm going to discard these gloves and I'm going to set up my sterile field.
Stop. What are you guys saying to me? You said I'm going to raise the head of the bed. Oh.
First, I'm going to lay down this chalk so that I have an area to discard anything that I need. Before I open the sterile field, I'm going to wash again with soap and water. I'm going to wash it and drying my hands completely. And now that I'm discarding, now that that's done, I'm going to be opening this away from myself. Pulling this out. I can discard this time. I'm opening away from myself first, and then each side, and then towards myself. And I have a 1-inch border, so I'm going to adjust how I need, and now I'm going to apply my sterile gloves. Now I'm only touching what would be the inside, which is going to be touching my skin. And now I'm only touching this arm, the inside of the cuff. At this time, I can only touch sterile materials, and since this glove is a little messed up, I can go and fix these fingers now. I go ahead and discard that. So now I'm going to set up and drape my patient.
Sorry, guys. Okay, ready? Yeah. Okay. Ready? Yep. My name is Jordan, and I'm going to be performing a tube feeding with my patient. I'm going to come in and I'm going to introduce myself.
I'm maintaining a 1-inch border around the outside of my sterile field.
I'm going
to set up my Foley. I'm going to insert the tip of the catheter into the lube. And I'm going to take my syringe and insert it into this port.
So I can do an abdominal assessment for my feeding.
Now that my Foley is set up, I can go ahead and clean my patient.
So first I'm going to inspect for any.
So now my non-dominant hand, I'm going to open the labia. I'm going to first start by cleaning down the left labia and discarding the right, discarding, and right down the center in a circular motion, and I can discard all of that at this time. Now I'm going to bring over this sterile field right in the middle of my sterile field here. I'm taking out the catheter from the lube, and I'm going to insert it at this time. I'm making sure that my right hand, which is sterile, is not touching the patient. Now that I have it inserting, I'm going to insert it until I see a flow of urine. And there it is. Okay, so now I'm going to insert another 2 inches. Great.
And I would also check if there was an
now that is inserted into a proper length, I'm going to inflate the balloon 5 milliliters.
first I'm going to
Okay.
pinch and remove.
Now I'm going to take that off. I would have been more careful taking that off. And now I'm going to pull back until I feel resistance, which I have.
And then I'm going to just aspirate a little tiny bit gastric fluid.
This time I can discard all of my materials.
And then
I would take a clean cloth and wipe off a little bit of the saline that I dripped on my patient.
pH of the stomach should be between
I'm going to attach with the stabilization device right here on this leg, so that the port is for sterilization. So
dark orange color.
sample is visible and that I have enough slack so she can move around freely. And I'm going to attach the bag below the bladder on the bed. I would remove this drape, but because you have to cut it to remove it, I want to maintain it not cut so that my partner can use it later. I would make sure the patient is comfortable, back to a good lying position.
I took back out.
I would discard all of my materials,
Flush with
and I would make sure they're comfortable and that everything is good. I would lower the bed to the lowest position, and I would discard my sterile gloves, and I will wash my hands and perform hand hygiene with soap and water.
Check that I have the proper.
Okay, now that a doctor's order has been given to remove the Foley, I can go ahead and do that. I would come into the room, provide privacy, ID my patient, check for allergies, and I would perform hand hygiene with soap and water.
How much I have to feed the patient. I'm going to pinch the
Now that I can raise the bed,
syringe, insert the desired amount, the
When it
ordered
is-
amount.
visualize the Foley. I'm going to take it off.
Not too fast and not too
Of
slow.
the bed.
I don't want to give them gas. Then I pinch again.
I'm going to
About
deflate
3/4
the balloon,
And I
removing the
insert
5 milliliters that I
more,
had inserted
insert
before.
if it's asked for. Then I can take my saline or my sterile water, and I would flush again with about 30 milliliters.
Great.
Then I'm going to pinch.
Now I can discard all of these materials. I'm going to discard this straight.
I'm going to be leaving my patient sitting up about
Make sure she's
for about an
comfortable.
hour.
How is everything feeling today? Good? Great. Okay. And I would perform hand hygiene and make sure the call bell is in reach and that the bed is in the lowest position.